Gentlemen, let's have an open, honest conversation about a subject that many men, especially after the age of 60, often avoid speaking about: masturbation. Yes, I said it, a word that carries with it decades of stigma, jokes, and myths. But here's the truth: it is a completely natural, normal, and healthy part of human sexuality. And for many men in their later years, it continues to play an important role in both physical and emotional well-being. But I must tell you something I see repeatedly in my clinical work. After 60, the way your body responds is not the same as it was in your 20s, 30s, or even 40s. Certain habits, things that once worked perfectly, can actually create discomfort, tissue strain, or even potential health issues if they continue unchanged. That is why this conversation is not just about pleasure, but about your prostate comfort, your vascular health, and your overall well-being. So today, I am going to walk you through the 3 biggest mistakes I see men over 60 make when it comes to masturbation, and more importantly, the safe, effective alternatives that protect your body and keep your sexual life both enjoyable and sustainable for years to come. This is not about shame, this is about knowledge. And gentlemen, as someone who has spent her career studying men's health, I promise you, once you learn how to adapt your approach, you will not only protect your body, but you may also discover new levels of pleasure and comfort you didn't expect. Before we dive in, a quick reminder: this video is for educational purposes only. It is not a replacement for direct medical advice from your own doctor. If you ever have symptoms that concern you, seek professional guidance right away. Now, let's get into the mistakes. Mistake number 1: not using lubrication or using the wrong kind. This is by far the most common error I see in men past 60. Why? Because as we age, the body changes in subtle but important ways. One of those changes is a natural decrease in skin moisture and lubrication. This means that the friction you once tolerated easily can now cause microtears, irritation, or redness in the sensitive skin of the penis. Think of it this way: your penile tissue is like a fine leather glove. When new, it is soft, supple, and flexible. But as time passes, if you don't condition it, it dries out, stiffens, and is more prone to cracking. Without adequate lubrication, every stroke increases the risk of tiny injuries you may not even notice immediately, but they can add up. And in some cases, this repeated trauma has been associated with conditions like Peyronie's disease, where scar tissue leads to painful curvature. The safe alternative: make lubrication your best friend. High-quality lubricants reduce friction, protect delicate tissues, and actually increase pleasure. Water-based lubricants are easy to clean, gentle, and compatible with condoms. Silicone-based lubricants last much longer, making them a wonderful choice if your sessions tend to be extended or if you have naturally drier skin. Just remember, silicone lubricants should not be used with silicone sex toys. What should you avoid? Oil-based lubricants with latex condoms, because they degrade the material and increase the risk of breakage. But if you are not using condoms, some natural oils like coconut can work well for external use. The bottom line: don't skimp. Apply generously and reapply whenever needed. This is not indulgence, it is protection. Mistake number 2: using excessive force or aggressive technique. This is the second major mistake, and I cannot stress it enough. Many men carry over habits from their younger years. In youth, squeezing harder, moving faster, or applying pressure often seem to intensify sensation. But after 60, your erectile tissue, blood vessels, and nerve endings are not as resilient as they once were. Overly aggressive handling can actually reduce sensitivity, damage the very structures you are trying to preserve, and lead to bruising or even nerve compression. I've spoken with men who confess that they powered through by gripping harder because they felt their sensitivity had declined. Ironically, this only worsens the problem. Imagine pressing down too hard on a piano key. It doesn't create better music, it simply strains the instrument. The penis is no different. Too much force reduces blood flow, tires the tissue, and can leave you with lingering discomfort or numbness. The safe alternative is to shift your mindset. Focus less on speed and force, and more on sensation and rhythm. Slow down, explore different techniques, use your whole hand, not just your fingertips. Incorporate pauses, lighter strokes, or even gentle squeezing at the base rather than repetitive hard pumping. Think of it as savoring a fine wine rather than chugging a glass of water. And above all, listen to your body. If you notice pain, tingling, or anything that feels off, stop immediately. Pleasure should never come at the expense of long-term function. Mistake number 3, neglecting hygiene after ejaculation. This one surprises many men because it seems so simple. But in my clinical practice, poor post-masturbation hygiene is a leading contributor to irritation, infections, and lingering discomfort in older men. Here's why. After ejaculation, residual semen and sweat can remain trapped under the foreskin or in skin folds. In younger men with robust immune systems, the body often handles this without issue. But as we age, especially if you have conditions like diabetes or an enlarged prostate, your body is more vulnerable to bacterial overgrowth. That leftover moisture becomes a breeding ground for infection. The safe alternative is straightforward. Wash gently with warm water immediately after ejaculation. If you prefer a cleanser, use only pH-balanced, fragrance-free options designed for sensitive skin. Avoid harsh soaps, alcohol-based wipes, or anything heavily scented. They strip away your natural protective oils and irritate the skin. And always dry thoroughly. This simple step lowers your risk of urinary tract infections, balanitis, and uncomfortable skin reactions. Now, why do these 3 mistakes matter so much? Because they are not just about avoiding short-term discomfort. They are about protecting your long-term sexual health. Healthy tissues, good blood flow, and intact nerve sensitivity are all critical for your erections, your confidence, and your intimacy with a partner. And here is my message to you. By being mindful, by using lubrication, practicing gentleness, and maintaining hygiene, you are actively investing in your future well-being. You are not just preventing problems, you are creating the conditions for greater pleasure, confidence, and comfort for years to come. Gentlemen, let me leave you with these takeaways. Listen to your body. Pain or discomfort is never normal. Pay attention. Be adaptable. As your body changes, be willing to change your approach. Frequency is personal. There is no universal right amount. What matters is what feels healthy and fulfilling to you. Hygiene is non-negotiable. Before and after, protect your skin and reduce risks with simple washing. And one more crucial note. If you ever experience persistent pain, bleeding, unusual discharge, significant changes in sensitivity, or ongoing erectile difficulties, please consult your doctor or urologist. Early detection of issues always leads to better outcomes. Masturbation is not the enemy. Shame is the enemy. Ignorance is the enemy. By understanding these 3 mistakes and avoiding them, you empower yourself to enjoy a sexual life that is not only safe, but deeply satisfying. Gentlemen, if you found this conversation valuable, I encourage you, hit the like button, subscribe, and turn on notifications so you don't miss future videos. Leave me a comment below. Which of these 3 mistakes surprised you the most? I would love to hear your thoughts. And in our very next session together, we are going to address another important topic, low libido after 60. Is it normal? What causes it? And most importantly, what can you do about it? You will not want to miss this discussion. Until then, stay healthy, stay curious, and above all, stay connected to your own vitality.